Hello, everyone, and welcome to Environmental Justice Now, our broadcast dedicated to creating community conversations around issues that are being faced and how we can come together to create positive change. My name is Casey Lassiter, and I am the Community Outreach Organizer with Virginia Interfaith Power and Light. Here at VAIPL, we collaborate with people of faith and conscience to grow healthy communities by advancing climate and environmental justice. Today, we will be discussing some public health issues facing Brunswick County and how they might relate to environmental justice issues and how we can come together to make positive change. I'm joined here today by my lovely and inspiring coworker, Margaret, who is our Regional Outreach Coordinator based in Brunswick County and the Brunswick Health Ambassadors. Margaret, would you like to introduce your friends from Brunswick Health Ambassadors?
Certainly. Good morning, Casey. Today, we have three members of the Brunswick Health Ambassadors with us. Debbie Burkett, who is co-chair of the Brunswick Health Ambassadors. Jeanette M. Grimes, MHS, who is community health worker for Brunswick Health Ambassadors. And Michelle Clary, Brunswick Health Ambassadors treasurer and treasurer of Brunswick County Cancer Association. We're so glad to have them with us here today.
Well, thank you for joining us today, Debbie, Jeanette, and Michelle. So before we get started today, I would like to do a brief land acknowledgement. While we were on a video call right now and many of us are joining from different places, we want to remind ourselves that we gather on the unceded land of the Indigenous peoples. I am joining in today from present-day Richmond, Virginia, and I am currently located on the land of the Powhatan and Chickahominy peoples. And my friends in Brunswick County are on the lands of the Saponi, Lumbee, and Kawatska. If you are unsure whose land you are on, please visit native-land.ca to find out. So Margaret, can you tell us a little bit more about Brunswick County and what inspired you as an outreach organizer with VAIPL to get connected with the Brunswick Health Ambassadors?
With adventure and exploration at fingertips' reach, there's plenty to discover here in Brunswick County, Virginia. Brunswick is the proud home of the original Brunswick stew, but stew isn't all we do. You can explore our sites along the Civil War trails, the Civil Rights and Education Heritage Trail, and travel along the Tobacco Heritage Trail, which spans roughly 14 miles across the county from Lawrenceville to Broadnax, along the previous Norfolk and Southern train rail. Another historic treasure is Fort Christiana, which was the westernmost outpost of the British Empire and a trading hub established, which was the westernmost outpost of the British Empire, and a trading hub established in 1714 until it was disbanded in 1718. It is also a stop located on the Virginia Birding and Wildlife Trail. Take a stroll down memory lane and visit the Valentine's Post Office, home of the world-famous Valentine's stamp. Thousands of Valentines are sent out each year to receive this special heart-shaped stamp, which we think adds that extra touch of love. In addition to all of this, Brunswick County has a very important organization called Brunswick Health Ambassadors. This organization has as its mission to improve the health, well-being, and quality of life for the residents of Brunswick County by educating the people about healthy eating habits, promoting good exercise programs, and healthy preventive measures with the primary goal of improving the health rating in all categories in Brunswick County. Living in a rural southern county in Virginia comes with many challenges. Brunswick County is predominantly Black. It also is an impoverished county and has health challenges that show Brunswick County is faring worse than the average county in Virginia for health outcomes and worse than the average county in the nation. Brunswick County has colorectal cancer 50% higher than the rest of Virginia. Diabetes 150% higher than the rest of Virginia. Prostrate 200% higher than the rest of Virginia. The gap in primary care across access 300% higher than Virginia. The gap in dental care 400% higher than Virginia. The gap in mental health care, 600% higher than Virginia. And all of these gaps put Brunswick County at greater risk than the national average. These facts are what inspired me as a worker with VAIPL and environmental justice to get connected and become involved with Brunswick Health Ambassadors.
So it sounds like from what you said, Brunswick County has some profound strengths when it comes to nature, outdoor recreation, and historical relevance, which cannot be taken for granted in a world of never-ending development. However, we can see some of the serious economic challenges that have left the community maybe feeling a bit left behind in terms of lack of investments in the area, especially when it comes to education, public health, and job opportunities. So I just want to talk a little bit about how public health and environmental justice might come in to play together. Margaret, do you see that there is some interconnectedness with the public health and environmental justice?
Absolutely. Public health in a rural town is deeply interconnected with environmental justice because the health of individuals in these communities is often impacted by environmental factors such as pollution, lack of access to clean water, or hazardous waste exposure.
And Jeanette, since you're working with the public health department, are you willing to share some data or research that you are aware of? Margaret already kind of briefly touched on some of these facts about how, cancer rates are higher in the area. There's a lot of health issues that are a lot more prevalent in the area. So is there any other information you would like to share that highlights some of these most pressing issues that are being faced by members of your community?
Absolutely. So as Margaret mentioned, our cancer rates are very high. We have been focused on our community health rankings in recent years, and Brunswick Health Ambassadors has really been involved in keeping the community up on where we rank nationally. So colorectal cancer is very high in the area, different cancers, lung cancer. We have concerns about water. So we like to inform our community about the importance of keeping up on their screenings because the data is really detrimental for our area. So we want them to know we are working with them, bringing them resources, being a resource so that health outcomes can be improved.
Michelle, I know that you are working with the cancer nonprofit there, the Brunswick County Cancer Association. What kind of community resources might be available for people looking to improve their health? And yeah, how can the members of Brunswick County access some of these resources that you all are talking about to better take care of the community?
Yes, the Brunswick County Cancer Association, we're here to help the citizens. We give monetary donations for citizens that have cancer. So if you are in the community, if you reside in Brunswick County, you have cancer and you fill out an application with us and give us a copy of a doctor's bill, a hospital bill, electric bill, phone bill, will help with the financial part of dealing with cancer. So if anybody needs to contact, they're more than welcome to contact me at my phone number, 434-774-5678. And we'll be glad to send you that application so that way you can get it filled out. And like I say, we keep the applicants as applicant numbers. So nobody in our organization will know your name and know that you get any help. But like I said, we know there's a lot of people in this county that need some help. And we're just trying to get the word out that we're here and we're here to help.
And that's awesome that you guys are doing that. What kinds of strategies are you using to kind of reach your community? What is the main kind of form of outreach? And also, Debbie, maybe even you could talk a little bit about who you're meeting with and talking to advance these goals that you all have as the Brunswick Health Ambassadors. So who are you guys meeting with, and how are you sharing this information?
We will meet with anyone who gives us an opportunity, to be honest, but we have worked closely with our county and town governments, one, to educate them on the health disparities that exist in the county and some of the needs. We have done some joint grants with the different entities. With the town of Lawrenceville, we did the HEAL grant, which was encouraging walking and exercise program, and helped develop some walking groups throughout the county or throughout the town. We worked with our local fire departments to try and develop a county-wide walking challenge to get folks up and walking. There's 7 fire departments in the county, so that did a lot of outreach along those lines. We've worked with different groups. The Robert Wood Johnson Foundation, not only do we use their statistics to help look at how we are doing health-wise, but we received a grant through them to promote health and welfare throughout the county, where we held our first leadership forum back in 2019. We also did a school program that did an exercise activity, not just for a day, but better eating and healthy snacks to help parents figure out things for the summer. We had over 800 children that participated in that program. We have done different, not just a health fair, but we have done health summits. One was with veterans to help them be better informed about services that would be available to them. We have done programs on diabetes, since that is a very leading cause of health concern in the county. We have sponsored health forums along with not just our local government officials, but with Congresswoman McClellan's office participating, for them to better understand what the needs are in the county. We only have 3 doctors in the county that's serving over 16,000 individuals. So that's 1 doctor per, over 5,000 individuals and things. So they cannot begin to meet the needs. We have done focus groups with Virginia Commonwealth University. We've actually provided an opportunity for medical students to come and present information to us, and we critique them to help them better be able to communicate with patients and things along the lines. We have worked closely with our schools. Something that's simple, one of the main produces in the county is sweet potatoes, which is one of the healthiest things for diet. We have sponsored sweet potato days at the schools, where children learn about how potatoes grow, but how nutritious they are and things along those lines. We have partnered with Virginia State University to work with our farmers in the county to better understand how to irrigate and have healthier products that they grow, and how to present them for market and things along those lines. We have a committee called Farms to Family that have helped establish at the high school the greenhouse, and to teach our students how to grow vegetables, be it from seeds all the way to production and things along those lines. We have increased gardens and have raised beds that our senior citizens are using. So we've done a whole array of partnership, and this all started with a group of concerned citizens and interest groups that came together back in 2014 to create this organization.
Yeah, it sounds like y'all are doing some really things and actually very engaged with the community. And it sounds like the community is also engaged as well. Is there any kind of gaps that you see with the community engagement and all these, partnerships that you're working on? What are some challenges there when trying to get these resources out to people? And what are some of the challenges that you all see when trying to engage the community and get them involved in the work that you're doing? Jeanette, if you want to.
I think we are always welcome to talk about it, but having them to truly engage and come to the table to work together to overcome the barriers that exist. We have many barriers in the county. Part of it's economics, part of it's lack of transportation, part of it's that we're an aging county where our younger individuals are leaving the county because of jobs or lack of jobs here in the county and things. So we have many challenges here that we're trying to have people recognize and really help partner with us to try and overcome them. Mm-hmm. Jeanette, what are you seeing?
One of our things, Casey, is making our presence known. Brunswick Health Ambassadors has been here for years, but yet we have still not reached everyone. So we're reaching out to you, ask who we speak with, and as many folks as we can. We make our presence known at community events, faith-based organizations, even parent meetings, to get things out there, to let them know that we are partnering with the Virginia Department of Health to help get immunizations, to help get that good doctor care, to get those resources. There's been a resource directory created and then updated for people to have those resources in hand, because some people don't know how to navigate or advocate for themselves. So we play a big part in that. And as was said, there are a lot of concerned citizens here in Brunswick Health Ambassadors, and we are really spreading the word. And just event-wise, back in the fall, there were different events, from a family fun day to increase awareness to the youth and seniors and everyone in between. We've had that leadership forum that started back in 2019, and we redid that again in the fall. And that's really coming alive because we asked the community, not just what can we do, but what will you do? And we've had action. And so we have a follow-up program coming in March, and we're really excited about that, coming back together to say, wait, it's not just us, it's we, BHA and the community. So it's going well, and there's still work to be done because we're still losing people, but we're still educating people. So we're still working.
That's awesome. Yes, bringing together the community is really how we get things done on a local level. So I just maybe wanted to ask if there's any other ways that you all might think we can move forward in Brunswick County to really advance these health initiatives. And you kind of already mentioned about how you're getting everyone involved, from the kids to the parents to the elderly. But yeah, is there any other ways that we can really move forward on this? Whether that's getting involved with our local laws, legislation, creating public-private partnerships. How do you see this kind of moving forward in Brunswick County?
One of the things I wanted to add, Casey, is that the lack of internet and accessible Wi-Fi. A lot of as Debbie said, 3 doctors, over 16,000 people. So telehealth, not only the education in telehealth, but the access to telehealth would be a boon to the county. When you live in a place where you have USDA food deserts, the fact that people have to drive 15 to 20 miles to go to a grocery store or a pharmacy, those are the kind of things that if we could get help with would be appreciated. So I just wanted to add that.
Yeah.
I had to step out for a minute.
And that's how the conversation kind of comes back to environmental justice as well. All these things are interconnected: economic justice, public health, environmental. And even though Brunswick County is, a rural county that has low development, there's access to trees and nature. There is, as you mentioned, those food deserts. There's also, you all mentioned an old tobacco plant. Brunswick County used to be, a tobacco hub, and that has, contaminated soil and waters for generations to come. And, maybe this has something to do with the higher rates of cancer in the area, lack of access to clean and healthy foods, contaminated water and soils. Are there, any other thoughts on how these issues might be connected with the environment as well?
Michelle?
Well, I think, we definitely have an issue. We make sure we have clean water, and like I say, that tobacco being raised on this land for so many years and stuff and all. I think a lot of it has attributing factors to what we're seeing now with the issues we have.
Well, if that's all, I really appreciate the work that you all are doing. Are there any final thoughts that anyone would like to make sure they get out to the public about the Brunswick County Health Ambassadors? Michelle, you look like you have.
Yes, I wanted to also just add a note and all that we partner with Hitting Cancer Below the Belt in Richmond to be able to offer fit kits for our citizens in the county. We have them available. If they want to reach out, we'll be glad to get them a kit. People laugh at me, but I have my little poopy hat that I go around at events and tell people that I'll give them a kit to test their poop. Because as you can see, colorectal cancer is very predominant in this area.
Yes.
And we need to make sure people know it's not just something that people that are 40s and 50s that are dealing with it. There are people in their 20s or 30s that are now having issues with colorectal cancer. And we have those kits that, they're convenient. You get a kit, you take it home, you just, poop and put the little swab on it and send it back in the mail. So it's not like you have to go anywhere publicly to do it. It's all in the comfort of your home. We'll get it sent out, get tested, get a doctor to look at everything and let you know what's going on. So that's a good resource that we have. So just reach out to us and we'll be glad to get you that kit.
Awesome. And we will definitely share that resource with the people here in Richmond as well. And is there any way?
We also want to thank you for giving us the
Yes.
opportunity to share information about the Health Ambassadors. We welcome anyone to come and join our group. We just ask you to have the enthusiasm to help turn things around in the county. I also want to mention that we have partnered in the years past very closely with Massey, which is part of Virginia Commonwealth University in the hospital there. They've had an office here, a Cancer Resource and Research Center that is regretfully now closing for reasons that which weren't happening. But I will say that cancer is a definite issue. We know it is because of environmental reasons, whether it is diet, whether it's soil, whether it's water. Nonetheless, it's a real issue in Brunswick County. But we are also here to help connect individuals to care and services along the way, even with the office closing. But more importantly, I'd like folks to know that we are their advocate to help get things across. We can be a voice, we can be information resource, but come and join us and we can make a difference.
Awesome. Thank you so much. And is there any ways that VAIPL, we can continue working with you all to advance the message? Margaret, how do you see us kind of working with the Brunswick Health Ambassadors to help advance their priorities of creating healthy communities as well, which we share in common?
Well, I know that Virginia Interfaith Power and Light is a voice in the dark areas of environmental injustice. And I have seen the work that both organizations have done just recently, 2 years with Virginia Interfaith Power and Light, and the last, 6 to 8 months with Brunswick Health Ambassadors. And I would like to see these two organizations work together in the future. As for colorectal cancer is 50% higher in Brunswick County than the rest of Virginia. That's scary to me, especially knowing that Chadwick Boseman, the Black Panther, died in his 40s from colorectal cancer. So whatever we can do to get the word out. I know that Virginia Interfaith Power and Light does lobbying at the General Assembly. I guess they call it lobbying. I know our executive director and other members are there all the time. We are supporting bills for clean air and clean health and the reduction of greenhouse gases. So I can see that these two organizations could be viable resources and assets, not only to Brunswick County, but to the entire state of Virginia as Brunswick County shines its beacon.
Yes, ma'am. It is all about community coming together to make these changes, and it wouldn't be possible without these, grassroots movements, people on the ground, working with, talking with, engaging with their community. So I'm very thankful that we were able to have this conversation about public health in Brunswick County and get that information out to the public. And we can't ignore the conversation of environmental justice when we're talking about public health, because we want to make sure that these communities aren't facing the undue burdens of environmental hazards. And most importantly, that these resources that are available to prevent and improve health are available. So thank you for, working towards creating those resources, making sure the community is aware of them, and sharing those, and being engaged citizens of your communities, and engaging with your local governments and organizations to make that possible. So take advantage of these resources and get involved. Check out the Kidding Cancer Below the Belt. Look more information up about this stuff so we can improve our health together, because we have to do it together. So thank you. Yeah.
And Casey, I just wanted to tell you and Virginia Interfaith Power and Light, thank you so much for giving us this opportunity. And to the women workers of Brunswick Health Ambassadors, I am indebted to you. And I thank you so much for joining us today.
Thank you.
Thank you.